Liaoning and Ningxia Hui Autonomous Region. With us today, Mr. Jie Yingcai, Commander of Xiangyang City Epidemic Prevention and Control. Madam Chen Yanlan, from Vice Chairman of Xiangyang CPPCC, and Mr. Wang He, Liaoning Provincial Parent-Up Group, and Mr. Li Shaoping from the Xiangyang Medical and the Health Committee. First, I give the floor to Mr. Jie. Friends from the media, netizens, since the outbreak of epidemic, the Party Committee and the government of Xiangyang has earnestly implemented the instructions of CPC Central Committee and General Secretary Xi Jinping, and also deploy the plans made by the Hubei provincial government, and we focus on the following 4 areas. First, we make all efforts to treat patients, and we tried all the different ways to increase our admission rate, and let the bed to wait the patients, not let the patient wait to have a bed available. And right now, we also prepare the beds available for the possible suspected or the confirmed cases in order to make sure we have enough beds for the confirmed patients and 1 separate room for suspected cases. Make sure all the patients can be treated. And second, we use different ways to increase our recovery rate. We mobilize the 10,000 medics and also the 600 medical members from Liaoning and Ningxia Autonomous Region, and also the engineers from the third-party institutions, and also make targeted measures to treat patients. For the mild patients, we give the combination of TCM and Western medicines. 96% of the patients use the TCM and also prevent from worsening the symptoms. And for the severe and critical cases, we organize a panel of experts and use the most advanced equipment, and also centralize the 3 designated hospitals to treat the patients in order to increase the recovery rate and lower the mortality rate. Third, we also do everything to protect our medics. Make sure the medical supplies should first go to the medics at the front line, and also strengthen the awareness of self-protection of medics, and also give strong support of the medical supplies. And third, we do everything to cut off the spread. Third, we talk about the quarantines. We have 302 places with more than 10,000 rooms available, and we have enough resources to identify the patients. And for close contacts, besides the special cases, the close contacts all have a single room for isolation. As of now, we have 9,580 people and have 700 people freed from medical observation and transfer 408 people to hospitals. And we also screen out the patient with fever, and all these patients sent to the hospitals. For clinical fevers that we found suspect cases, we all keep them at the fever clinics, and for the cases that cannot be ruled out, and we all quarantine them as suspected cases standards. And third, we also treat the recovery patients in quarantine, so we extended our working process to the recovery stage. For recovery patients we discharged from the hospital, they're also in the centralized quarantine for 7 days. Started from February 22nd for all the cure cases, and also to stay in the quarantine for 14 days. And fourth, we also strengthen our efforts in the community and village level management. For the village communities, we conducted 24 hours lockdown management, For the communities or villages with confirmed or suspected cases, the leaders should make an immediate report and conduct the most stringent management. Fifth, we also have a good work on the public area management. For non-necessary public areas should be all stopped, and for the one that need to open, and we also go with the most strictest standards, and also we have the transportation restrictions imposed, and also have the most stringent way on the positions and the key areas. And we also conduct our regular screening efforts, make sure no household left unchecked, and also take the community and the village as one unit, and we check door by door, household by household. If we find patients with a symptom or fever, we send them to the hospital immediately. Second, we organize 64 teams to track the close contacts of infected case or suspected cases, as well as asymptom patients, as well as the people under medical observations. More than 60,000 people under our screening. Right now, still have 2,210 people under our screening monitoring. Starting from February 5th, we expanded the CD image scope from the suspected cases to all the patients in fever clinic. And we also expand our scope of NAT from the suspected cases and confirmed cases to the close contacts as well. Recently, for the susceptible population and the medical teams, we also conduct the NAT plus CT tests. And fourth, we do everything to make sure the supplies and guarantees. Starting from January 28th, we made an all-out effort to conduct our work. 55,000 party members in our city participated in our work to help to screen the people's temperature, to help to deliver the daily necessities, and also help to manage the community lockdown. And second, we also do a good job to guarantee medical supplies. We tried all different available channels to allocate and mobilize the medical supplies. So far, the medical supplies are in tightened balance. For N95 protective suits for the ICU areas, we also make more efforts to make sure they can fulfill the needs for 5 to 7 days. And third, we also do everything to fulfill people's basic needs for daily life. Talk about the vegetables, meat, egg, oil, cooking oils, vegetables, and that can fulfill the people's need, and also start to have that delivery service available. For the center of the city, that's fully covered. For 6 areas and villages, based on their local features, we conduct the delivery service in order to meet the people basic needs, especially the one with the daily basic allowance. So we also help them to buy the vegetables and the eggs, milk, and we also had a special support measures to help them to overcome the difficulties, and we also guarantee the normal operation of the city. Currently, the situation right now is still at a good trend, but we should not to slacken up our tension and containment efforts. As of February 26, the total confirmed cases reached 1,175. We still have 443 cases right now in hospitalized and with treatment. And second, talking about the new confirmed cases in the recent 5 days, the new confirmed cases, just 2, the 0 reported in the recent 2 days. But we talk about this treasury is good, but it's not saying that we already clear up all the potential risks. So which means we still have a prominent challenges to make sure we can prevent the virus from spreading outside and spreading inside. Going forward, we will continuously to implement the key instructions and deployment of CPC Central Committee and General Secretary Xi Jinping. And also we should grab the opportunity provided by the key window period, make sure all the implements can be earnestly carried out, make sure we can win the battle against COVID-19. Thank you. Now I give the floor to Chen Yanlan to introduce the pairing up program carried out in Xiangyang on behalf of Liaoning medical teams. First of all, thank you everyone's interest in the Liaoning endeavor in Xiangyang. The mission given by the CPC Central Committee and State Council to Liaoning, the head of the Liaoning government attached great importance, and we sent the 3 teams to Xiangyang province on the January and February 4th and 10th. Right now we have 420 people here in Xiangyang, and they came from the Chinese Academy of TCM and Liaoning Renmin Hospitals, Liaoning Jingqiu Hospital, and Liaoning Tumor Hospital, and including the Department of Respiratory, ICU, the CCM, TCM, pharmacy, and also the nosocomial infectious management, as well as the pediatrics. We have 157 doctors, 80 with senior titles. Liaoning is a big city with sufficient medical resources, and we also sent 1,660 medics to Wuhan city. Upon our arrival in Xiangyang, the Liaoning medical team had carried out the following works. First, we made a scientific arrangement deployment with the unified deployment of Xiangyang city government. Our 420 medical teams are divided into 7 small teams, and we work with the team from Xiangyang to create the synergy and fill in the weak links, and also work with other teams, especially the team from Ningxia Hui Autonomous Region, so we can create a reasonable deployment and arrangement of our medical resources and treat the patients effectively. So far, Liaoning conducted our work in the city hospital, the first hospital, and central hospitals, these 3 designated hospitals, and Nanzhang Township, Yizang, Zaoyang, the 4-level hospitals. And we have taken over 16 wards. And second, we conduct the frontline fight against epidemic. The 16 wards with 474 beds available, and we admitted 304 patients, and we cured 100 patients, and 91 patients admitted at the peak time, 14 with severe or critical conditions, and we successfully treated 3 patients with severe conditions, and also we have 1 patient with ECMO right now do not need to have intubation treatment. Besides the ICU team, we also have other teams from Department of Pediatrics and from the Chinese Academy of the medicals, and we have 11 doctors and 11 nurses from Department of Pediatrics, and we admitted 64 patients. The youngest is 16 months old, the elderly is 6 years old, and we also have team from TCM, and also have the team from the emergency. And we also conducted our telemedicine service in order to improve the recovery rate, to lower the mortality rate, and also increase the treatment capability. And we work on the front line, also at our headquarters, establish the temporary expert panels. The expert on the front lines, they conduct the consultation on the treatment of the critical patients and also the nosocomial management. We have 27 experts on the front line. And at our back headquarters, we had our Ma Xiaochun to lead the panels that across the discipline. We have 58 experts. They work around the clock to work with the experts on the front line to conduct telemedicine, the consultation of the wards, and also give suggestions on the therapeutic plans. And right now, all the teams have the telemedicine platform available and have 11 cases discussed through this platform. And fourth, we also do everything to supply the medical resources, including that the 34 high flow monitors, 9 respirators, and 4,300 protective suits, 23,000 masks, N95, and the 37,000 surgical masks, 50,000 goggles, and 3,920 TCMs. And we also have an MPA, 5 MPA that will be soon arrived in Xiangyang in these 2 days. Going forward, based on the Xiangyang's requirement and needed, we will send more medical supplies, especially protective suits, to Xiangyang. Fifth, we give more care and love to our medical teams. Talking about the nutrition meals, the daily necessities and accommodations give us great support. And with the strong support and back provided by Xiangyang City and our headquarters, and we can fully concentrate on our work. First, we focus on our medics to strengthen their awareness on protect themselves, and we also had the work code of conduct and increase the standards of protection. On the other hand, we also do a good job to do the psychological counseling, make sure we give them enough care, and also make sure they have enough rest, and also keep up the high morale. Going forward, we will continuously implement the key instructions given by General Secretary Xi Jinping on disease prevention and control, as well as the requirement of Liaoning Party Committee and government, and also work with the unified deployment of a Xiangyang government and work with the Liaoning medical team and the Ningxia medical team to successfully finish the mission given by the CPC Central Committee and State Council. Thank you. Now the floor is yours, Mr. Wang He, to introduce the pairing up program carried out by Ningxia Hui Autonomous Region Medical Team. Friends from the media and netizens, thank you very much for your attention to the Ningxia medical team. According to the deployment of CPC Central Committee and the key instructions of the General Secretary Xi Jinping, the Ningxia Hui Autonomous Region Party Committee and the government attach great importance on we should act as playing on the same chessboard. We allocated the best team across the region and sent to Wuhan and Xiangyang for medical assistance. From January 28th, we have sent 6 batches with 728 medics to support Hubei province. As the only team representing the Southwest region, we work with other 19 teams to support Hubei. And on February 24th, according to the Xiangyang's government's requirement, we make the modification. And we also work with the Xiangyang TCM Western Medicine Hospital, Xiangyang Infectious Disease Hospital, and Xiangyang the Occupation Hospital, and Xiangyang CDC. The Aviation 304 Hospital in Xiangyang, and Xiangyang Second Renmin Hospital, Laohekou City Hospital, Gucheng City Hospital. And we conduct work in the above-mentioned hospitals, and we also establish our code of conduct, the working process, to conduct our work in a well-orderly and effective manner. As of February 26, Ningxia medical team to Xiangyang had admitted 2,000 2,082 people and managed 1,747 patients and conducted consultation on 625 cases and gave a psychological counseling to 837 people. And we had 788 patients discharged from the hospitals. In transfers hospitals, Ningxia hospitals, and also work with other 7 hospitals to conduct telemedicine consultation. And we gave the consultation to 3 cases with severe or critical conditions. At the same time, we also conduct disinfections with 5,300 square meters that covering the A3 confirmed cases family and also for the quarantine team, and also give the guidance to the disinfections, and also finished the epidemiology research on top of our existing work, and we also focus on the allocation of medical supplies, and we donate the 6 invasive respiratory and 3 non-invasive ventilators, and also donate to Hubei province 400 tons of rice and 150 tons of vegetables. And we not put our interest on it, and we will do everything to give our top priority to the work. And the key leaders also paid attention to our daily necessity supplies and also our daily life. I would like to take this opportunity to show our gratitude for your care. And going forward, we will carry out the instructions given by General Secretary Xi Jinping on furthering giving the care to the medics, and also based on the local features, we will allocate and modify our team structures and make sure we can do everything to treat our patients. Thank you. Now the floor is open for questions. Please identify your media affiliation before raising the question. With Hubei TV, on February 23rd, General Secretary Xi Jinping made a key instructions, which also laid out the action plans. I believe right now everything rely on the implementation. So how Xiangyang carry out the work in this regard in details. Thank you. Since the outbreak of the COVID-19, Xiangyang City government has earnestly implemented the key instructions given by Secretary Xi Jinping and deployment of CPC Central Committee. Based on the developing situation in Xiangyang, we have actively found out the effective and practical measures in Xiangyang. I would like to introduce some of them here. First, in order to achieve the principle of admitting all patients as needed, we prepared available beds ahead of time. At the beginning of the epidemic, and also based on the population of Xiangyang as well as the economic activities, and also the population flow, and we also take a reference to the experience from SARS. We also conducted the survey and the suggestion with the experts, made our comprehensive decisions. And on January 24th, we should make sure that we should have enough rooms that prepared for the regular number of citizens in Xiangyang, and make sure that the implementation is in details. Xiangyang with a 6 million population, which means we should prepare the beds around the 1,200. So by all different means, we better utilize every minute to make beds available. From the actual practice, so far, the accumulated cases, 1,175. Suspected cases, the peak numbers, 985. These two numbers compared to our estimation is quite close. So we have enough beds ahead of time, so make sure we can implement the principle of admitted patients as possible, and also lay solid foundation for the following prevention and control work. Our second measure is to prevent the virus from exporting outside and spreading inside. And we make sure we can monitor the flow of the population and also carry out the stringent transportation restriction. Based on the unified deployment, we implement all the measures in this regard, and we suspended the outbound channels such as airplanes, trains, and also the shuttle bus, and also established the stations to check the vehicles. And internally, we talk about we conduct the unnecessary outdoor activities, and also enterprises, if not necessary, they should not resume work. The criteria are following. We talk about that should fulfill the need of prevention and control as well as treatment. Second, fulfill people's daily necessities. And third, the need for the normal operation of the city. So these three areas should be guaranteed. And for the people in the three above areas, and we optimize the whole travel routes and also open the green buses on the green channel, which means we conducted the disinfections regularly, and also have 17 buses dedicated to medical people, and make sure all these buses should conduct the disinfections, and should also open the air condition to make sure a good ventilation, and the bus drivers and also the passengers on board should wear masks. All these make sure we can conduct effective prevention and control work, and also the city operate in a wild manner. And third, we talk about the community level. We had a fresh way, which is a two reporting system. We released the requirement on January 28th. We require the party members from the government units should practice these two reporting system. First, they should report to their managers. So regarding the health condition and their location, if they need to participate in the prevention and control endeavor, they should went to the working place. If it's not necessary, they should participate in their community level endeavor. So far, we have 55,000 party members conduct their work on the community level or village level work. And they work with volunteers and the local authorities to shoulder the responsibility to educate the public about the knowledge for disinfections, the delivery service. Is effectively mitigate the pressure and short of hands on the front line at the community or village level. Fourth, after the lockdown of communities, how to guarantee people's daily necessity. We had a mobile service, delivery service, started from the beginning of February. We first roll out the vegetable delivery service at the center area, so people did not need to go outside, so they can enjoy the fresh vegetables. Right now, 2,115 villages or the communities fully covered by this delivery service, and other areas also rolled out this practice, and we have the delivery service available. Make sure we have few population flows conducted, make sure that we can cut off the spread of the virus. For the household with basic living subsidies, we also deliver the vegetables, milk, eggs to this group of people on a regular basis, and this practice also rolled out to other township and communities. Talking about the type of vegetables, right now not only cover the vegetables, we also send meat, milk, egg, and also for our delivery service, not only deliver the vegetables, meat, egg, milk, and we also help to deliver the medicines. Of course, we still have room to improve. Going forward, we will further implement the delivery service and also enrich our delivery baskets, make sure we can fulfill people's needs during the lockdown period. China Daily. We talk about the city rural areas actually hold the key to contain the virus. What's your practice in this regard? I'll give this question to Mr. Li Shaoping. Thank you for your question. So Xiangyang City, we focus on the screening on the key population, make sure the virus not spread inside the city. By requisitioning, renovating, or expanding the buildings to make sure the suspected cases can have one single room, and we make sure no patients spread other people outside the hospital because of no beds available. For 2 negative NAT results, these patients should maintain in the hospitals. For patients reached the discharging standards or suspected cases, they will be in centralized quarantine for another 14 days. By doing so, it will help us to decrease the possibility of spreading the virus. And for close contacts, we also put them together for medical observations. For people stay at home, it's quite difficult to manage all of them and also have a potential of risk. That is why we also requisitioned hospitals and also in total 302 wards for quarantines for the close contacts with confirmed cases or suspect cases. They will stay 1 room per person for 14 days in quarantine. For close contacts, we'll also conduct the NAT. As of February 26, we have finished 5,411 people. For people with positive results, they transfer to hospitals for treatment. Third, we're also screening the patient with fever. For the people went to the fever clinic, we conducted a CT and the irregular blood test. For CT exams with positive results, they will hospitalized as confirmed cases. For the patients could not rule out possibilities, and they will be treated as suspected cases. And for further NAT tests, as of February 26, the patient with a fever we conducted 20,098 CT tests and 3,438 NAT. And we conducted epidemiology research on suspected cases and confirmed cases. And for close contacts with confirmed cases or DA positive to NAT, we also conducted epidemiology research. For close contacts, we also put them together under the medical observation as of February 26th. 16,274 close contacts were the close contact with an NAT test. We talk about whether it's the asymptomatic or symptomatic patients. We all put them in the quarantine or hospitals as required. We do all-out efforts to cut off the source of a virus and do everything to make sure the virus not spread. Thank you. Liaoning Daily. My questions regarding the pairing up program carried out by Liaoning program, and what's the team structure and what's the consideration behind? Thank you for your question. For the pairing up assistance, and we conduct our work to take over wards to treat the patients with critical conditions. So we also focus on the four centralization, which is the resources, experts, patients, and resources. So we set the top of the experts to take over the wards or hospitals and provide the treatment to the critical or severe cases. As for the program in Xiangyang, we conducted the targeted pairing up program, and we made the studies, and we also sent the experts and also the people from different departments. We maintain the original structure of the team, and we also organized the 7 medical teams to support 3 designated hospitals and 4 township hospitals. For doctors, nurses, and other medical teams that can create the synergy among the different departments. So we have the people from a department of CCM, ICU, infectious disease, respiratory, and also people from TCM, psychology, the cozonomial infectious disease. So the team actually already know each other, and they also work together before, so they can have a really seamless, smooth working mechanism. So we can create the synergy to better treat the patients, and also can leverage the strengths of the experts to treat people, especially the patients with critical conditions. It's Ningxia Daily. My work question regarding the work carried out by Ningxia Hui Autonomous Region Medical Team. What's the result so far, and what's the situation with our medical teams? Thank you for your question. Regarding treating patients, we conducted an all-round treatment plan. No matter it's in the fever clinic or the ICU, regarding our clinical nursing work, we better utilize the TCM and the Western medicine, as well as the psychological consulting. We give the serve treatment to patients and also give them the confidence and the courage to defeat the disease. And we have 3 hospitals at our headquarters, and also with other 7 medical teams, we conduct the telecommunication consultation. And we made the consultation on 3 critical cases. This is also conducive to help the local medical work. This also helped to improve the recovery rate. Talking about the morale among the medical personnel, the first batch to Xiangyang, 135 medical personnel worked in Xiangyang for more than 1 month. But no one really like to fall back. They're saying that as long as we kill all the disease, can we take a rest? Duan Jingjing support the Laohekou Hospital. The original plan is she had her marriage ceremony February 9th, but when she received the order to assist the Hubei, and she volunteered, applied her name, and she also discussed with her great friend, saying I need to support Hubei. Let's postpone our marriage ceremony, and they reached agreement and postponed their marriage party. And we also have another nurse that supports Xiangyang Central Hospital. Graduated from Xiangyang Occupation Hospital, actually. She took Xiangyang as her second hometown. This time back to Xiangyang, he also with that appreciation to Xiangyang. She said that I didn't come here with any fear. I didn't think about what I should do later on, because for the medical personnel, this is my responsibility to complete the mission. This is our responsibility. All in all, our team members always keep at a high morale and have full confidence to defeat the disease. Renmin Daily. How Xiangyang conducts your study on the development of disease and how you can take an effective plan to curb the spread of the disease. Thank you for your question. The evening of January 24th, the CDC confirmed the first case of COVID-19 in Xiangyang. And we'll also make more analysis in details on the first case. So far, the case is actually a people with Hubei travel history or the close contacts. And later on, we have more cases that's a local spreading phenomena. So far, many townships had no new cases reported. We touch a great importance on analyzing the development of disease, and also we pull the wisdom of experts. At the very beginning of the outbreak, we established a panel of experts. We conducted a meeting in this regard. First, we conducted a scientific manner to study the development of disease. We collected, analyzed the epidemiology information. We had a daily report in details in terms of time, space, and population to find the common features, and also talking about the bus station, train station, and we conducted a temperature screening, make sure we have less imported cases happening. And we also conduct a regular analysis and also carried out screening, it's the door-to-door screening campaign. Second, we also conduct a new way to study the epidemic. We learned the full knowledge of cases, so when the cases happened and where the case found, and when the symptoms shown, and when the patient went to the hospitals, when the hospital reported to confirm the cases. So we try to reflect the full and real picture of the disease. And we also monitor the situation in the fever clinic. And we also conduct a tracing mechanism and conduct the NAT as early as possible and to identify or root out the possible cases. Based on the different stage of the containment, we set 6 criteria and to evaluate the performance of different regions, make sure all the measures implemented and find out the shortage or the weak links. And we also will conducted the effective measure to fill in the weakness. And we also conduct the consultation to study the virus. And we find out the targeted group, targeted place, and targeted link. And we also find a ground for decision making that all a solid foundation for us to win the battle. As we just learned, Liaoning established the 4 featured team. Would you please talk more about the team of pediatrics and the TCM team? Thank you. Thank you for your question. Talking about the pediatric team, the Leishenshan Hospital sent the best team from Department of Pediatrics, and they also ranking high among the other teams in China. And also based on the Xiangyang's feature, we also sent 11 doctors plus 11 nurses from Department of Pediatrics and took over 4 wards. with 64 patients. For each child, we conducted a customized therapeutic plans. So far, 31 babies cured and discharged. And for the different levels of anxiety, we also conducted the psychological counseling to the babies and their parents. And we also purchased 21 boxes of toys and books. So through these kind of the parent-children activities help to mitigate the anxiety. This works very well. Regarding the combination of TCM Western medicine, we utilized the strengths of Liaoning TCM University, dispatched 22 doctors, 18 nurses. So we signed this team with a total 40 medic personnel to give the support Xiangyang First Affiliated Hospital, Xiangyang TCM Hospital, to conduct the TCM plus Western medicine treatment. We took over 2 wards, and we followed the scientific approach. And right now we have seen 3 patients. Their symptoms already changed from the severe to mild condition. I believe with more medical workers pay their contribution, we will see more patients cured and discharged from the hospital. One last question. My question regarding Ningxia medical team. How you arranged your team structure facing a shortage of medical supplies. Thank you very much. Indeed, as you mentioned, Ningxia Hui Autonomous Region is a small place. The medical resources actually rely on the purchasing outside. The number I introduced, the 6 dispatch groups of the medical teams with 728 medical personnel sent to Wuhan and Xiangyang, and we took over the wards and ICU. These numbers means that all these number of medical personnel actually sent the best team from Department of ICU, CCM, respiratory medicine, and infectious disease, which means 50% of our medical working forces sent to Hubei province. And also, we sent to Hubei because given the background of increasing confirmed cases number. On the 3rd day of Lunar New Year, we also have the order issued from the local government saying we should send the best of the best team to Hubei. And within 1 hour, more than 2,000 medical personnel applied. And you can see we sent the cream on the top to Hubei province. Thank you all the speakers, and thank you, friends from the media. That's for today's presser. Thank you.